Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome to English for Non-Subject Specialist for medical students at Tripoli University for the first semester. Today we are going to deal with Unit 10, the first aid, and of course, you know that the first procedures in the medical processes starts with saving patients, and of course having some basic techniques for first aid. Of course, many patients, if they have the appropriate first aid procedures before they go to the hospital, many lives might have been saved. But first aid is a must, is a very important issue. Not only field special in box or so as I said, these issues about this. In this class, we are going to start talking about these basic procedures or techniques. Then after that, we are going to discuss some of the vocabulary related to the issue and some of the grammar issues related to that topic. So listen carefully and let's start.
Unit 10, First Aid. Exercise 5, page 23.
Basic first aid techniques. In a medical emergency, always call for assistance first. The following are basic steps to take to help an injury victim before medical help arrives. Assess the victim's condition. Give him or her plenty of space. Prevent shock by elevating the legs and covering the victim. Wound should be cleaned and wrapped in a bandage. Cool minor burns with running water. If the victim's pulse or breathing has stopped, CPR or rescue breathing can be performed. Be sure to clear the victim's airway before rescue breathing is carried out.
Okay. Let us listen again. Then after that, we are going to answer the questions true or false. Read the first aid guide, then mark the following statements are true or false. Number 1, bleeding wounds should be wrapped with a bandage. Use running water to cool burns. Rescue breathing can clear victim's airway. So listen again and answer these questions true or false.
Unit 10, First Aid. Exercise 5, page 23.
Basic first aid techniques. In a medical emergency, always call for assistance first. The following are basic steps for an victim before medical help arrives. Assess the victim's condition. Give him or her plenty of space. Prevent shock by elevating the legs and covering the victim. Apply pressure to lacerations or other open wounds to stop bleeding. If bleeding has stopped, wound should be cleaned and wrapped in a bandage. Cool minor burns with running water. If the victim's pulse or breathing has stopped, CPR or rescue breathing can be performed. Be sure to clear the victim's airway before rescue breathing is carried out.
Okay. Okay, so if you look here at the red lines, we have what's called imperative verbs and if conditionals. Imperative verbs, أفعال الأمر. So in medical emergency, or assistance, call. So this is an imperative verb. So call, it means you have to immediately. So this is an imperative verb, فعل أمر. And the negative of, to make it negative, we say don't call, or never call. So these are the negatives. Give him or her plenty of space. Negative. Don't give him plenty of space. Never give him plenty of space. So this is the negative. Apply pressure to lacerations. So don't apply pressure. So apply pressure, do not apply pressure, or never apply. So here for the negative, you can say don't apply or never apply. Okay. Conditional. So if we go again for the if here, so we say if bleed has is if doing in here? This is called, this type of if conditional is called type 1. What does it mean, type 1 conditional? Just I want to okay, so if I say for if conditional, we have type 0. It's called type 0. What is type 0? So we say it is present simple, present simple. What does that mean? Present simple, present simple. So we say if water reaches 100 degrees Celsius, it boils. So if water reaches, this is a present, boils present. Reaches 100 degrees Celsius, يصل إلى 100 مئوي, it boils, يغلي. So this is a fact. So type 0 هي present simple tense مع ال present simple tense مع الحقائق الكيماوية، الحقائق الحيوية، الحقائق الطبية. So you say if, for example, if a patient gets an electrical shock, yes, apply the first aid procedures. So if a patient يحصل له صدمة كهربائية, apply first aid اللي هي في الاسعاف الاولي. So here it is, yes. In the book في كتابنا اليوم أو في الحصة ماذا قال هو؟ If bleeding has stopped, wounds should be cleaned and rubbed. هننتقل من type 0 إلى حاجة اسمها type 1. type 1 هنا هنتكلم عن شيء آخر اللي هو possibility, الاحتمالية. So we say if, it says here, if bleeding has stopped, في حال توقف الدم يعني, if bleeding has stopped, wounds should be cleaned. في حال توقف يجب أن ينظف الجرح, should be cleaned and rubbed. إذن and rubbed. إذن عندي هنا should be cleaned. إذا حصل الحدث الأول اللي هو أو الواقع الأول, إذا توقف النزيف, في حال توقف يجب أن نفعل كذا. So this is, we say type or if conditional. So now let's go back. Let's go back to the class. Now we have the true false, the true false. Okay, so for number 1, as we said, it is false. And number 2, the running water, use running water to cool burns. Yes, this is true. And finally, rescue breathing can clear a victim's airway. So this is false. No, this is not possible. Okay, now we are going to go to the vocabulary. So we have the first list of vocabulary matching. Match the words 1 to 6 with sentences A to F. So number 1, shock. Shock is number D. A medical emergency in which the circulatory system cannot provide oxygen to the body. Okay, so this is number D. Number burn. Burn, number 2 is F. It is F. A physical injury that can be caused by heat. Pulse is A. It is A. A normal regular heartbeat that can be felt when an artery is pressed. Then number 4, rescue breathing. It is E.
first aid procedure involving providing air for someone who has stopped breathing but still has a heartbeat. Laceration is C. It is an open injury caused by a hard impact to soft body tissue. CPR is finally number B. It is first aid procedure involving chest compression and artificial breathing. So these are some of the most important, we say, vocabulary today. And then we finish with wound, first aid, bandage, pressure, and assess. Okay. So for number one, the doctor will need to, we say, assess the victim's condition. Okay, I'm trained in basic techniques. I'm trained in basic first aid techniques. Number three, apply to the injury to stop the bleeding. Apply pressure to the injury to stop the bleeding. Wash the injury and wrap air around it. So wrap a bandage. The nurse use stitches to close the wound. Yes. Okay. So these are, again, another list of some important vocabulary. Now we are going to listen to the second part of the conversation between a doctor and a patient. We are going to choose the most appropriate answer. So number one, what is the conversation mainly about? Treating a burn, teaching first aid, healing a cut finger, removing a bandage. Two, what will the woman likely do next? Cover the injury, clean the laceration, remove the bandage, or apply pressure to the cut. Okay, so let us listen. Then we listen and answer then the questions as they come in tab.
Exercises 6 and 7, page 23.
Hello, Bill. What's troubling you today?
My finger really hurts.
Let me take a look at it. Yes, it's all red with a blister. What happened?
I touched a hot stove.
I see. Did anyone provide first aid?
Yeah, I ran some cold water over it.
Well, it probably helped. It should be fine in a few days. Just put aloe vera on it.
Thank you, Doctor. I'll try to be more careful.
Okay, listen again.
Exercises 6 and 7, page 23.
Hello, Bill. What's troubling you today?
My finger really hurts.
Let me take a look at it. Yes, it's all red with a blister. What happened?
I touched a hot stove.
I see. Did anyone provide first aid?
Yeah, I ran some cold water over it.
Well, it probably helped. It should be fine in a few days. Just put aloe vera on it.
Thank you, Doctor. I'll try to be more careful.
Okay, so for number one, what is the conversation mainly about? As you listened, yes, it's about treating a burn. So number A is the right answer. What will the woman likely do next? The woman means the doctor. So the doctor, she's going to cover the injury. So again, it's A. Okay, now we are going to listen. And we are going to write the missing words. And if there is some issues related to grammar, we are going to take them. Okay, so this is Bill again.
Exercises 6 and 7, page 23.
Hello, Bill. What's troubling you today?
Hello, Bill. What's troubling you? What's troubling you today? What's troubling you today? Yes.
My finger really hurts.
My finger really hurts. My finger really hurts. Okay. Now we have an imperative verb. Okay. فعل أمر.
Let me take a look at it. Yes, it's all red with a blister. What happened?
So let me take a look. Take a look at it. So let me هذا فعل أمر. Let me take a look.
I touched a hot stove.
I see. Did anyone provide first aid?
Did anyone provide first aid? Okay.
Yeah, I ran some cold water over it.
I ran some cold water over it.
Well, it probably helped. It should be fine in a few days. Just put aloe vera on it.
Thank you, Doctor. I'll try to be more careful.
Well, it should be. Well, it probably helped. It should be fine. Yes, just put aloe vera on it. So this is a medication. Yes. Okay, now, then in the last part, we have some issues related to grammar here. So we say, if you look at the sentences here, what happened? So you are asking the patient what happened. So asking about description or a history. So what happened? So he said, I touched a stove, a hot stove. So his finger burned. Let me take a look at it. Let me check it for you. Let me see it. So here, this is an imperative, فعل أمر. You'll be fine in a few days. You'll be fine. Here, you can use this here. You'll be fine if you take your pills. You'll be fine if you take your medication. If you do some exercise. You'll be fine if you don't do this again. So here we can use if conditional here with this statement. Okay, now this is the end of unit 10, and we are going now to move to another unit, which is unit 11. Okay, unit 11 is an important part of the medical procedures, is how we say using abbreviations, الاختصارات. Abbreviations are a very important part in the medical procedures, because people don't use we say long or the whole expressions. So say ER room. What is ER? ER, it means emergency room. So we don't say emergency room, we say ER or the CPR. Okay, so we have these abbreviations even with some diseases like we say STD or STDs. So here it's just OBG, for example. So we have some expressions. We don't use the full term because to save time and it is easier to use. Okay, so here we have a patient evaluation. So we are going to listen to a patient evaluation in the hospital, and they are going to use some, let's say, HRT, temperature, BP, XR, and we have OE. So here we have some issues related to the let's say medical terms and medical abbreviations, الاختصارات. Now let's listen and then answer the questions as they come in turn.
Unit 11, Common Abbreviations. Exercise 5, page 25. 5.
Scottsville General Hospital. Patient evaluation. Date, April 12th. Patient name, Christine Gordon. ID number, 6612431. Sex, female. Physician, Harold Downs, MD. Attending nurse, Susan Smith, RN. Time, 23:15. Patient condition, stable. Patient vital signs. T, 100.6 degrees Fahrenheit, as taken by oral thermometer. HR, 81 beats per minute. BP, 140/90. Respiration, patient CO-SOB. Notes, XR shows no acute lung disease. Blood sugar levels are WNL. OE patient appears to have high levels of anxiety. The patient is a smoker and has a high stress profession/lifestyle. DX. The patient likely has HTN, but further testing and lifestyle analysis will be required. RX options will include diet/lifestyle adjustment and medicine.
Okay, so here we have T, temperature, heart rate, pressure or blood pressure, X-ray. So we have here is OE, the optical examination. So here we have these abbreviations as they come here. Now, let's listen again. Then we answer the questions as they come in front of you for the true false. Number 1, the patient shows signs of acute lung disease. The doctor doubts that the patient has HTN. The patient complains of high anxiety. Listen again, then answer the questions.
Unit 11, Common Abbreviations. Exercise 5, page 25.
Scottsville General Hospital. Patient evaluation. Date, April 12th. Patient name, Christine Gordon. ID number, 6612431. Sex, female. Physician, Harold Downs, MD. Attending nurse, Susan Smith, RN. Time, 23:15. Patient condition, stable. Patient vital signs. T, 100.6 degrees Fahrenheit, as taken by oral thermometer. HR, 81 beats per minute. BP, 140/90. Respiration, patient CO-SOB. Notes, XR shows no acute lung disease. Blood sugar levels are WNL. OE patient appears to have high levels of anxiety. The patient is a smoker and has a high stress profession/lifestyle. DX. The patient likely has HTN, but further testing and lifestyle analysis will be required. RX options will include diet/lifestyle adjustment and medicine.
Okay. Now, let's do this, the number 1 to number 3. Okay, so number 1, the patient shows signs of acute lung disease. No, he said no signs, so this is false. The doctor doubts that the patient has HTN, false again. And then the patient complains of high anxiety, yes, because of his lifestyle, so this is true. Now, we are going to match the words with the vocabulary with their definitions. Okay, so number 1, HR. HR is number E. The number of heartbeats in a given amount of time. So heart rate or beating rate. 2, B, P is number D, it's blood pressure. So the amount of force applied on blood vessel walls by circulating blood. So that's the blood pressure. DX, number 3, DX is C. It is the identification of an illness or disease. Then number 4, T. T is number B. Okay, B, which is the amount of internal body heat measured. Number 5, CO is number A. To describe uncomfortable symptoms. And number 6, WNL is F, to be at an average level. So this is F. And OE is finally is number G. It is the discovered while investigating a patient's health. Okay. Number 7 is G, yes. Okay, now we are going to finish the vocabulary. Sentence pair, read them, choose where the words best fit the blanks, SOB, XR, the, number 1, the clearly show that bone was broken. So because it's a bone, so this is an X-ray. The asthmatic patient complained of SOB. RXHTN. XR. Okay. So this is number A is RX. For the infection included antibiotics. Then the patient with high blood pressure was diagnosed with HTN. Okay, so this is what we have for the vocabulary part. Now we move to the second listening. We are going to listen to the second conversation. And while we are listening now, we are going to
Exercises 6 and
Okay, so while we are listening, we have to answer the following questions. So number one, why does the man ask the woman for help? He cannot read the doctor's writing. He doesn't know the patient. He doesn't know the patient's condition. He needs her authorization for a prescription. He hadn't seen one of the abbreviations before. What does the note say? The patient's hypertension has gone away. The patient complains of muscle pain. The patient complains of shortness of breath. And the patient is diagnosed with asthma. Now, let's listen and then choose the appropriate answer.
7, page 25. Hey, Susan, can you take a look at these notes from Dr. Downing? I just can't read his writing.
It is pretty messy sometimes. Let's see.
Look, is this C-O or O-E?
It's hard to tell, but I think it says patient C/O SOB.
Ah, that makes sense. I can see it now. And this is the diagnosis here.
Yes, it says DX-HTN.
So the patient has hypertension.
That's right.
Okay. Listen again.
Exercises 6 and 7, page 25. Hey, Susan, can you take a look at these notes from Dr. Downing? I just can't read his writing.
It is pretty messy sometimes. Let's see.
Look, is this C-O or O-E?
It's hard to tell, but I think it says patient C/O SOB.
Ah, that makes sense. I can see it now. And this is the diagnosis here.
Yes, it says DX-HTN.
So the patient has hypertension.
That's right.
Okay, so for number one, it is the difficulty of reading, so he cannot read the doctor's writing. So this is called eligibility. Eligibility معناها قابلية القراءة. هل شيء مقروء أو غير مقروء. So if I say this is eligible, means you can't read, and this is one of the problems of writing. So you have, when you write your prescription, الوصفة, when you write it, you have to make it clear to read. Okay, number two, what does the note say? It is number C again. The patient complains of shortness of breath. Okay, now we are going listen again, and then we are going to fill the gaps as usual. Yes, with the missing words in here.
Exercises 6 and 7, page 25. Hey, Susan, can you take a look at these notes from Dr. Downing? I just can't read his writing.
It is.
So I can't read his writing. Yes.
Pretty messy sometimes. Let's see.
Let's
Look.
see. Let's. إذن هنا فعل أمر مرة أخرى. Imperative. Let's see. Look. Look. This is an imperative again. فعل أمر مرة ثانية.
Is this C-O or O-E?
Is this C-O or O-E?
It's hard to tell, but I think it says patient C/O SOB.
Ah,
S-O-B.
that makes sense. I can see it now. And this is the diagnosis here.
Yes, it says DX-HTN.
So the patient has hypertension.
That's right.
It's the diagnosis. DXHTN. So the patient has hypertension. So he has hypertension. Okay. So far, we have taken this. This is called jargon, language of medical. We say the language
of the medical field is called the jargon. Jargon هو نوع الكلام الذي يأتي في سياق محدد في مكان محدد لمهنة محددة. So this is called medical jargon. So this jargon is COSOB, so diagnosis, hypertension. So these words are used in the medical field. And so here, number one, can you take a look at? Can you? So this is a gentle request. هنا طلب. Can you? I think it says. Let's say OE. I think it says HTN. So it says. That makes sense. That makes sense. That means it is clear now. So this is the language about, yes. Don't overuse abbreviations. Sometimes when you speak to a non-subject specialist من أحد مشاكل اللغة عندما توضح مسألة معينة إلى مريض أو إلى شخص غير مختص, don't use, we say, or overuse jargon language. لا تستخدم لغة الاختصاص لأنه الذي أمامك وليس بمختص. So you have to make things easier كما سيأتي إن شاء الله في الإنجليزي 2, English 2, English 3. You have to be sociable with your patient. You have to be nice with your patient. You have to have a rapport. Rapport, it means نوع من الرابط مع المريض. So you have to use clear language, not highly technical, complicated language. Okay, till here we finish the class. I hope that you liked the topics within this lesson, and inshallah, I wish you all the best in your exams, midterms, and finals. Thank you for being with me, and see you all, inshallah, well and in good health next time. مع السلامة.